Hey everyone, welcome back to Medcomplete Board Review. Today we have a 29-year-old female with a past medical history of HIV who presents to you for the complaint of painful swallowing. The patient's inconsistent with her HIV medication and states, "I take the medicine when I remember." Her current CD4 count is 66 with a viral load of 150,000 copies per ml. Physical exam is normal except for the following image. Which of the following is the most appropriate next step? Hey everyone, welcome back to Medcomplete Board Review. I hope you're all having a great Labor Day weekend. So the answer to the previous question we posted regarding our 29-year-old female with HIV who has odenophagia is B. She should be started on oral fluconazole therapy. So in order to get this question right on the exam, we need to understand a few things. Anytime they give you an HIV patient on the exam who is immunosuppressed, meaning CD4 count less than 200, these patients, if they say, "I have painful swallowing," you should assume they have esophagitis. This is very important. This is an assumption that has to be made because the treatment is different. So, for example, if somebody just has oral thrush but no odenophagia, they don't have any painful swallowing, they could be treated with simply nystatin, swish and swallow. But once they say, "I have painful swallowing," or when food comes down, I feel a sensation in my chest, you have to assume that whatever is in their oral cavity has extended down to their esophagus. So if you see oral thrush in the mouth, you have to assume they have esophagitis secondary to candida infection in the esophagus, okay? And therefore, the treatment would now, instead of being nystatin, if it involves the esophagus, you have to give them systemic therapy with oral fluconazole. Okay, nystatin does not work for esophagitis. It only works for oral thrush. So once it extends down deeper into the esophagus, you have to go with systemic therapy. Now, candida is the most commonly tested because it's the #1 cause of esophagitis in HIV patients. But another question could have been if they showed you HSV, which is the #2 most common cause, if they showed you vesicular lesions in the mouth and the patient's describing pain while swallowing, then you would have to assume, again, whatever is in their oral cavity has extended down to their esophagus. So in that case, the answer would have been acyclovir. Okay. The third most common cause is CMV, and they tend to give you linear ulcerations, and obviously vanganciclovir will be the treatment there. But that's less likely to be tested on your exam. It's more likely that you will have candida or herpes being tested. IV micafungin is not a treatment of choice here. This is usually going to be for neutropenic fevers with candidemia. Then you can give them this. But in this situation, for all candidiasis, esophagitis, it doesn't do anything. Now, upper endoscopy is an answer that a lot of people generally pick, and there is a situation where this could be the right answer. So if the person, if this patient gets treated, let's say they have this picture, you give them diflucan or fluconazole, and the patient did not improve within 3 to 5 days, they don't have improvement of symptoms, then you should go in there and do an endoscopy to confirm that this is what they have, and you should do a biopsy as well to confirm the microbe that they have. The other situation where upper endoscopy would have been correct is if they have nothing in the oral cavity. So if the oral cavity is absolutely clear and this patient's complaining of dysphagia, you should do an upper endoscopy to confirm what the lesion is and the cause of that. And the treatment of choice. So it depends on what they give you on the test. If they give you an oral lesion that's obvious, then you can obviously jump straight to treatment. If the oral cavity is clear or the patient's resistant to treatment, then you go ahead and you scope these patients to confirm. Okay. I hope you found this helpful, guys. I hope you have a happy weekend. And if you have any questions, please leave them below.